Hello, I'm Catherine Anaya. Welcome to the Health Connection. I am joined by breast medical oncologist Dr. Albert Wendt. Thank you so much for joining us. So, Dignity Health recently did a study showing that more women are choosing not to have a mammogram. Why is that happening?
I think there's a multitude of reasons that include fear, uncertainty, recent breast screening guidelines by the U.S. Preventative Services Task Force that have kind of clouded it. Maybe even some embarrassment with the study. But it is a very important test nonetheless.
What kind of problems does that create when you see this happening?
So we know that breast cancer is our most common female malignancy and that it can occur starting at a relatively young age. And early detection has been key not only to survival but for outcomes in such as needing less treatment, less chemotherapy, no chemotherapy, less surgery, better preservation of breast. And by finding cancer early, we can really reduce the risk of people dying of cancer and having as much treatment.
So for women who are watching thinking, well, I'm still a little confused as to what I should do, what do you recommend?
So I think the average woman does not have many of the breast cancer risk factors that you think about, like family history, but the average woman will have ability to look at this risk assessment that we're providing and look at when their menstrual period started, how often there has been any family members with breast cancer, whether they've had a child at a young age, whether they've not had a child. And by looking at these various factors, we can choose and estimate a 5-year and lifetime risk for developing breast cancer and help guide women into choosing screening.
Is there a way to determine a woman's risk?
So there is actually tools that we're providing that can look at these various factors and give them a rough idea.
Well, there is a breast cancer risk assessment that you have, and we have a link to that. We certainly encourage all women to go and check it out. Well, thank you so much for joining us. Such valuable information. We certainly appreciate it, Dr. Wendt.
Thank you.
All right, we'll see you next time here on The Health Connection.